Forbes India Cover Story podcast series in association with theindicast.com. These are unusual times. India, along with most of the world, faces unprecedented challenges in the fight against Covid-19. And yet, there are some companies and sectors that are busier than ever in the pursuit to deal with this situation. The cover story package focuses on just that, and joining me to talk about the cover are Forbes India's Varsha, Meghani and Naini Thaker. Hi, Varsha, Naini, good evening.
Hi, Abhishek. Hi, Abhishek. Good evening.
Good evening. And before we dive into the story that the two of you have written, Varsha, if you could take us through, what was discussed in what is now a remotely conducted editorial meet. What is it that you guys had set out to achieve?
Sure. So, we wanted this to be, again, about, COVID and the fight against the virus.
Mm-hmm.
So we have a host of stories, about this. The cover story is about 7 startups that I have made the fight against COVID a common goal. We have another story on how, the 3D printing companies are helping, fabricate parts that are needed.
Right.
Especially for PPEs. We have a story on how agri-tech is fixing the supply chain, how crowdfunding is helping those who have lost their incomes. So there's a host of stories, all COVID related.
Right. Doing these stories itself, how is it for you as journalists discover things as they go along, because the pace at which things are unraveling is quite frantic. So how are you guys keeping up with it?
Yeah, luckily there's, Twitter and various other social media platforms that, give you information literally at the snap of a button. That helps us, keep informed. And, in terms of reporting remotely, that's not been as challenging as one would have thought. People are happy to speak over the phone, speak over video calls. So it's been, it's been interesting.
Excellent. So let's start with the piece that the two of you have collaborated on, and it says how 7 startups that have stuck their necks out, innovated and made the fight against coronavirus a common goal. Can you take us through a couple of them to start with? Naini?
Sure. I looked at about 4 of these startups. The first one being Asimov Robotics, and they essentially focused on creating robotics. And the founder, Jay Krishnan, he has, come up with these. Initially he set out to come up with robots which could serve people food. That's always been his focus, but it was more targeted towards the restaurant sector. And then now he shifted gears to moving into healthcare and health tech. He had, created these robots earlier when the Nipah virus had happened. And this is something when the coronavirus happened, when the pandemic hit India especially, this is an idea that struck him, and he's created these bots. I think the first one has just been, deployed in the Cochin Medical College. Exactly. So the robot can go inside the isolation ward, help out patients with food, medication, all of that. All the nurse has to do from sitting outside is sort of, put it on an app that this is the first person that you have to go to, second person, third person, so on and so forth. They also have a UV ray disinfectant box wherein the patient can put in all his or her used, stuff that they need to sort of discard, and that comes back out. So it's essentially taking care of things or places where the healthcares are sort of most vulnerable at, and doing their job for them. That's Asimov Robotics. So the second startup that I looked at is called Qure.ai. Now what Qure has come up with, it's an idea that the founder had, where essentially they're looking at x-rays of patients, and because x-rays are extremely cheap, this is a device that they've used earlier to cure tuberculosis. And what it does is, looking at the x-ray, it can tell what sort of, if the person has tuberculosis or not. So it can be used as a preliminary test. Now, the same thing, considering coronavirus is also a pulmonary disease, a similar sort of concept has been used here as well, where all you have to do is look at the X-ray and the technology, which is called QXR, using AI and ML, which has, data of about over 1 million X-rays stored in. All it does is it tells you if the person has coronavirus or not. Considering testing has been one of our major issues across the world, his technology makes it a lot easier and cheaper for people to test faster.
What struck me across all stories is that all these entrepreneurs have moved very swiftly to respond to a crisis of this nature, which is to tweak their either business models or the engineering itself. What were some of the things that they must have checked on the checkbox to get this right?
I mean, I have a feeling that it wasn't as easy as they made it look, to be very honest, because given the lockdown, I mean, I know for a fact that Jay Krishnan, for instance, he told me, I mean, it was very difficult for me to get some time with him because it was just 3 people in his lab who were allowed to work. Similarly, for innovation, because of the lockdown and given the situation, they barely have people who are working on ground. So while, I mean, they've come up with great technologies, this is a common problem that they have when it comes to scaling up, and all of them are in talks with the government. Qure.ai, for instance, is in talks with several government agencies, but the others, it's not been very easy for them. I mean, Docternal, for instance, they need a lot of data from the ICMR. That's taking a while because, of course, the ICMR is stuck with a lot of different problems. So for them to deploy the technology out there, that's taking a while. So I feel that the lockdown in itself has proven to be a massive challenge for them.
Indeed, and another story that struck me was that of Saral Designs, maker of sanitary napkins, and now they manufacture face masks. 30,000 masks a day. It hasn't taken very long. Varsha, what did you discover? How did you find out about them, and how did they manage such a feat?
Yeah, absolutely. I mean, this is really a story of agility and quick thinking in the face of adversity. So Saral Designs makes low-cost sanitary napkins. I mean, you of them because we've covered them previously when the pandemic struck India, and especially the demand for masks shot through the roof, but availability was scarce. Saral started looking into it, and they realized that the materials used to make sanitary napkins, the raw materials, are similar to those used to make three-ply masks. So they decided to re-engineer their machines to make masks instead. But like Naini mentioned, the lockdown was imposed and they couldn't find the parts that they needed to kind of reconfigure their machines to produce masks instead of sanitary napkins. So the CEO of Saral Designs, Sohani Mohan, shot out emails to, all her contacts. One of them happened to be a junior from IIT Bombay, where she studied, who works at Mahindra. So, and within hours of sending across that email to Mahindra saying that, hey, can we use, your factories will have these components. Can we, can we use them? She got a reply from Mahindra Automotive saying that, hey, we can help. So Saral sent them their prototypes of their designs. Mahindra fabricated the parts, sent it back to them. They reconfigured their machines. And then literally overnight, those entire machines were shipped to the Mahindra facility in Kandivali and production started. So it began with about 10,000 masks a day and it's now producing about 30,000 masks a day. And literally all of this happened within a week. So from the shooting out that email to that first lot of production of masks was about a week. So these startups have acted really quickly, thought on their feet, really responded to the crisis.
Another one that you write about is how a couple of folks in Gurgaon-based startup, they changed their product, which was aimed at prison inmates, to patients at hospitals. How is that? How does that work?
Yeah, absolutely. This is an interesting one. So StockU is a Gurgaon-based startup. They leverage artificial intelligence to monitor CCTVs in prisons. And this is primarily prisons in Uttar Pradesh. Now, they could have just sat put and, waited for the crisis to pass, since their product doesn't really cater to, anything pandemic related. But yet these guys managed to find a way to help out. So what they did was they've reconfigured their software to work in areas where there are no CCTVs. So for instance, you can stream that software on a mobile phone, which can be placed in a temporary hospital or an isolation ward. And they've taught the AI to detect something like, when a patient sneezes or coughs, that is relayed to a command center. And as soon as that information comes through, a nurse or a doctor can tend to that patient. So this helps with one, contactless monitoring, and two, in cases where you have low medical staff, this kind of remote monitoring helps. So that's one way where they kind of rejigged their solution to help with the crisis. And secondly, they've launched an AI-powered thermal camera to help with screening the body temperatures of people at a distance of 5 to 10 meters. So it's useful in places like airports, crowded places like airports where, you need to unmask screen people.
And not just some of these solutions, while they are aimed at the masses, you also have a story. I think Naini, if I'm not mistaken, you've done this, where there is a product which is squarely targeted towards cancer patients. Is that correct? Who have lost their voice?
Yes, what they do is they have designed this voice prosthesis, which is a tiny device. What they do is they puncture a hole in your throat, which becomes your new nose. Is what they say.
Right.
While we wear normal masks, which cover our nose, for them, since the throat is their new nose, what they need to do is cover that. And given the situation, and given that there are no masks for them, what these guys did is they created this sort of a scarf kind of a thing, which essentially is a bib, and using a creative design so that they don't look like patients, and using this sort of waterproof material, they have devised this laryngeal bib which ensures that they're protected in a situation like this. The good thing about this is now, given the crisis, and for the PPEs, they're in talks with a lot of people to possibly use the same material that is used to make the laryngeal bib to also create PPEs for healthcare workers. So yeah.
Right, especially important because patients with underlying conditions are the ones who are the most susceptible to the virus.
Yeah.
Also, another theme that runs through all these stories is that there needs to be thorough collaboration between companies, even if they are in different industries. One we saw of Mahindra and Saral. Another one is with respect to ventilators, which all across the world, including India, a dire need for. Varsha, if you could take this one, what is the real situation, and how important is the need for ventilators in India, and how are some companies grappling with it?
So the need for ventilators is pretty dire. We have, according to one manufacturer, we have about 40,000 ventilators presently across all hospitals in India. Of those, he said that about 25% are probably dysfunctional. So that leaves about 32,000 ventilators that are functional, which is not obviously not enough to deal with the kind of crisis because that we're facing. Because on average, a person might need say 5 to 7 days on a ventilator if it's a serious case of COVID, or an elderly person might even need 2 to 3 weeks on a ventilator. One doctor told me, because their lungs are weaker. So the need for ventilators is clear. So we spoke to a couple of manufacturers and their startups. One is a Bangalore-based startup called Biodesign Innovation Labs. Another is called Agva, which is Delhi-based. And they all make low-cost ventilators, and they've been doing so pre-COVID. But their production was about 300, 400 ventilators a month. Again, not enough to cater to the kind of demand that we're seeing right now. They decided to tie up with, so in the case of Agwa, they tied up with Maruti Suzuki to ramp up production. And likewise, Biodesign Innovation Labs, they've tied up with a company called Remedio that makes ophthalmology devices. But they've offered up their facilities to kind of mass manufacture ventilators. So you're looking at now thousands of ventilators being churned out every month thanks to these kind of partnerships. So you're right. Yeah, it's about startups collaborating with larger corporates, which you don't usually see, and you definitely don't see at this speed.
For a better world, hopefully, that there is such quick thinking and also execution that is in the works, and we hope that the situation improves sooner rather than later, and all of us can get back to work and people are back in the pink of health. And on that note, thank you very much, Varsha and Naini, for your time on this podcast.
Thanks, Abhishek.
Thank you.
Thank you. And all you listeners, you can get this podcast on ForbesIndia.com and on iTunes. And to have someone call you for a Forbes India subscription, message Forbes to 51818.